Welcome to our lecture on the assessment of the male reproductive system. Today, we will be covering key elements for evaluating the health of the male reproductive organs, including both physical assessment techniques and common clinical findings. Before we dive in, I just want to remind everyone of the importance of having a solid understanding of male reproductive anatomy and physiology. So if you feel like you need a refresher, take some time to review the basics of the male reproductive structures and their physiological functions on your own. Making sure that you understand the anatomy will help you make better clinical assessments and interpret findings with more accuracy. In this section, we'll focus on gathering subjective data for assessing the male reproductive system. This is the part of the assessment where we're really listening to the patient's experience and asking questions that allow them to describe their symptoms and concerns in their own words. There are several areas we'll cover here, everything from urinary frequency to pain, changes in the scrotum, and sexual activity. Each of these areas can give us essential clues about the patient's reproductive health, and they're often sensitive topics, so approaching them with professionalism and empathy is key. As we go through the next few slides, remember the OLDCARTS framework. That's the tool that we use to guide our questioning so that we can gather complete and detailed information about each symptom. For instance, we'll look at frequency, urgency, and nocturia, which are key indicators of urinary health, pain or discomfort, whether during urination or elsewhere, which might hint at infections or other issues, and past medical history or any recent changes in self-care, which could impact their current condition. Think of this process as building a patient's story, one question at a time. Now let's dig into the specific questions we'll use to gather subjective data. These questions help us get a clear picture of what the patient is experiencing so we can address concerns that might otherwise go unnoticed. Remember, each question isn't just about getting an answer, it's about building a complete narrative of the patient's health. For frequency, urgency, and nocturia, start with, do you feel like you're urinating more frequently than usual, or is it hard to wait when you feel the urge to go? For nocturia, you might ask, are you waking up during the night to use the bathroom? How often? It's essential to find out if this is a new development, as recent changes can signal a shift in the patient's health status. For dysuria, simply put, ask, do you feel any pain or burning when you urinate? It's a quick question, but it can reveal a lot about possible infections or inflammation. Hesitancy questions dig into flow issues. Try, have you noticed any trouble starting to urinate? Or do you feel like you need to push to get started? Follow up with questions about the strength of the stream. Is the stream as strong as it used to be? Or do you notice any dribbling after you think you're done? And as a wrap up, do you still feel like you need to go even after finishing? Hesitancy and straining can be related to prostate issues, so these questions are valuable for early detection. The key here is to keep it conversational while staying thorough. The questions should flow naturally, like a guided conversation rather than a checklist. Remember, the more detail that you capture, the better picture you have for both clinical reasoning and documentation. Next, let's focus on questions related to urine color and genitourinary history. Both areas can provide important insights into potential issues. For urine color, ask something straightforward, like, is your urine usually clear, or has it been cloudy, discolored, or foul smelling? This is simple, but it can reveal a lot. For example, cloudy or foul smelling urine could indicate an infection, while a reddish or brownish color might suggest blood in the urine, possibly from kidney or bladder issues. Encourage patients to describe any recent changes in urine color, as that can be a key indicator of a new or worsening condition. For genitourinary history, start with control issues. Have you had any trouble controlling your urine? Then clarify with questions about urgency incontinence, which is a sudden loss often seen with bladder infections. and stress incontinence, which is a loss of urine with physical activity, often due to weakened pelvic floor muscles. This distinction helps us determine what type of incontinence might be present. Next, you can ask about specific triggers. Do you ever accidentally leak urine when you sneeze, laugh, cough, or bear down? Understanding the triggers gives us clues about the cause and possible solutions. Finally, ask about any history of kidney or urinary issues. Have you ever had any kidney disease, stones, flank pain, UTIs, prostate problems? This background information provides context and helps us assess if current systems are linked to past conditions. As always, when documenting, try to capture specific details. Rather than just write urine cloudy, you document patient reports cloudy urine with strong odor lasting 3 days. These details help other healthcare providers better understand the patient's situation. Okay, so let's get into some of the more specific questions about the penis and the scrotum. Remember, these questions can feel a bit sensitive, so your approach matters. Stay professional and supportive to make the patient feel at ease. For the penis, start by asking the patient if they have noticed any problems with their penis, like pain or lesions. A simple question like, have you had any discomfort, sores, or other concerns with your penis opens the door for them to share without feeling embarrassed. If they mention discharge, dig deeper. Can you tell me about the discharge? How much is there? If it's changed over time, or if it has a specific color or odor. Discharge details are significant as they can indicate infections, and knowing if it's linked to pain or urination gives additional clues. Move on to the scrotum by asking, have you noticed any issues with your scrotum or testicles? Then follow up based on their response. For example, if they mention swelling or lumps, ask about changes in size or consistency, like have you noticed any lumps or changes in the size of your scrotum or testicles? Also, asking about a history of undescended testicles can be relevant, as this has implications later in life. Hernias are another area to cover here. Have you ever been told that you have a hernia? Do you ever feel a dragging or heavy sensation in your scrotum? Hernias and other conditions might not be obvious, but patients often recognize kind of a heavy feeling. This is an area where you want to be thorough and sensitive. Encourage patients to describe anything unusual that they've noticed. This can lead us to an accurate diagnosis. And as always, document each detail objectively and clearly so we have a complete record of their symptoms. Sexual activity and contraceptive use. This is an important area to address, as sexual health and satisfaction can directly impact a patient's overall well-being. Since these questions can be sensitive, remember to use gender-neutral terms and keep your language open and non-judgmental. Start by asking if the patient is in a sexual relationship. Try framing it as, are you currently in a relationship involving sexual intercourse? This phrasing is inclusive and provides a comfortable way for patients to discuss their experiences. Ask about satisfaction with their sexual experience. Are aspects of sex satisfactory to you and your partner? And are you satisfied with how you and your partner communicate about sex? This can give insights into issues impacting their quality of life. A common question for male patients involves changes in sexual function. You could ask, sometimes men notice changes in their ability to have an erection when aroused. Have you experienced any changes like that? Asking about this sensitively can open up a discussion about conditions that might be underlying, like cardiovascular health or stress. If relevant, ask, do you and your partner use contraception? What method do you use? And are you satisfied with it? Also check if they have any questions about their contraceptive method, as proper use and understanding are key to effective contraception. To get a sense of potential exposure to STIs, ask how many sexual partners have you had in the past 6 months. This is straightforward and provides context without making assumptions. Finally, ask about preference in a respectful way, which is essential. You might ask, what is your sexual preference? Do you prefer a relationship with men or women or both? This allows patients to share relevant information comfortably, giving you a fuller understanding of their context. Remember, your approach here should be relaxed, open, and supportive. Patients often appreciate a professional, non-judgmental space to discuss these areas, and you'll be better able to address any underlying health issues or concerns that they may have. Let's talk about questions related to sexually transmitted infections. This can be one of the more sensitive areas to discuss with patients, so approach these questions with empathy and maintain a non-judgmental tone. The goal here is to gather information that can help us provide the best care and address any concerns the patient may have. Start with a general question, like have you had sexual contact with a partner who has had an STI, like gonorrhea, herpes, HIV or AIDS, chlamydia, genital warts, or syphilis. It's important to mention specific infections as it might prompt patients to remember and share relevant information. If they confirm contact, follow up with questions about the timing and the outcome. Ask, when was this contact? Did you contract the disease? This helps us understand if there are any lingering health effects. Next, inquire about treatment. How was it treated? Did you experience any complications? This information is useful to determine any possible long-term effects or recurring issues. Ask about preventative practices. For example, do you use condoms or other methods to help prevent STIs? I'll usually ask my patients if they use condoms, and then I'll follow it up with every time or just sometimes, just to get an idea of how frequently they're using those condoms. Finally, give them the space to ask questions. Do you have any concerns or questions about any of these diseases? This question not only shows your openness to discuss their worries, but also helps to address any misconceptions or gaps in their understanding. When you're documenting, make sure that to capture this information accurately while being mindful of confidentiality. Patients might feel vulnerable sharing this part of their history, so respect and empathy are key. Now let's talk about some specific considerations for addressing aging adults. With age, many individuals experience changes in urinary and sexual function, which can impact their quality of life but may not be freely discussed. We want to start with questions about urination. Ask, have you experienced any hesitancy or straining, a weakened force of stream, dribbling, or incomplete emptying? These symptoms could indicate issues like an enlarged prostate in men or changes in bladder function. Then it's helpful to ask, do you ever leak water or urine when you don't want to? And to follow up with questions about any strategies they use to manage it, like using pads or tissues. This opens up a dialogue about incontinence, which is a topic that can be sensitive but is common in this population. Another question to consider is about nocturia, or the need to get up at night to urinate. Do you need to get up at night to urinate? And if so, what medications are you taking? What fluids do you drink in the evening? Sometimes minor changes can reduce nighttime disturbances. Finally, we'll ask about any issues with sexual function, which can be significant for many. A simple question like any change in your ability to have an erection allows the patient to share if they are comfortable, and it opens the door for discussing any interventions that could improve their quality of life. This approach is sensitive, but it also provides essential information that can guide care and enhance well-being for older adults. Now let's go over the objective data portion of the exam, starting with preparation and necessary equipment. First, we'll talk about preparation. When examining the male genitalia, position the patient standing with appropriate draping to maintain their dignity and privacy. Many male patients feel a level of discomfort, similar to how female patients may feel during a pelvic exam. It's important to be mindful of these feelings, as it can make the process smoother for both you and the patient. Approach this part of the exam with a confident, calm demeanor, which can help ease any tension. Remember, using a firm, deliberate touch is better in these situations. Soft or stroking touches can be misinterpreted and cause discomfort. For equipment, you'll need gloves, of course, for every examination involving genitalia. In some cases, you may need a glass slide if a urethral specimen is required. Additionally, have materials ready if cytology is needed, and a flashlight to improve visualization during the exam. This slide is all about setting the stage for a smooth, respectful, and efficient examination. The right preparation and equipment not only streamline the process, but also help ensure that the patient feels as comfortable and respected as possible. Now let's move on to inspecting and palpating the penis. We'll begin by observing the skin. Normally, the skin here appears wrinkled, hairless, and lesion-free. You might see the dorsal vein, which is usually quite visible. Next, inspect the glands. It should look smooth without any lesions. If the patient is uncircumcised, ask him to retract the foreskin, or you can do this yourself if necessary. The foreskin should retract easily, and after your inspection, remember to slide it back into its original position. Often you might notice some smegma, which is kind of a cheesy secretion that can accumulate under the foreskin. This is completely normal, but it should be gently removed if it is present. Now check the urethral meatus, which should be centrally positioned. To get a closer look, gently compress the glands between your thumb and forefinger, pressing in an antero-posterior direction. The edge of the meatus should appear pink, smooth, and without discharge. At each step, observe for any abnormalities like redness, lesions, signs of infection. These might indicate conditions that need further investigation. Keeping the exam systematic and thorough helps ensure nothing is missed, and it reassures the patient that the exam is being done professionally and with care. Next, let's move on to inspecting and palpating the scrotum. Begin by positioning the penis kind of out of the way. Either ask the patient to hold it, or you can gently hold it to the side with the back of your hand. This approach ensures clear visibility and respects the patient's comfort. Start with the scrotal halves. Use a gentle approach. Place your thumb and first two fingers around each half and palpate gently. Take note of the texture, the consistency. Each side should feel smooth and be free from lumps. After assessing the scrotum, proceed to palpate each spermatic cord. Using your thumb and forefinger, kind of trace the cord's length from the epididymis up to the external inguinal ring. As you do this, you're checking for any irregularities or tenderness. If you come across a mass, it's important to gather additional details. Describe its location, size, shape, any characteristics like whether it's firm or fluid-filled. Also, assess if the mass can be reduced with gentle pressure. Lastly, if you detect any swelling or mass, use transillumination to help distinguish fluid-filled from solid masses. By shining a light through the scrotum, you can see whether the mass transmits light, which typically indicates fluid, or remains opaque, which might suggest a solid mass. Each of these steps helps us gather essential information, which enables us to differentiate between normal findings and things that might require further investigation. One of the key elements of self-care that we want to emphasize with our male patients is the testicular self-examination, or TSE. Starting from ages 13 to 14 and continuing through adulthood, it's important that men learn how to examine their own testicles regularly. Why? Because early detection of testicular cancer can be life-saving, and that's only possible if they are familiar with what normal feels like for them. The best time to perform a TSE is during a shower or bath. Warm water relaxes the scrotal sac, making it easier to feel for any unusual lumps or changes. Now we can teach them a simple way to remember how to do it, the TSE method. T is for timing. Encourage them to do this once a month. S is for shower. Doing it in the shower makes the exam more effective due to the relaxed state of the scrotum. E is for examine. They should carefully check each testicle and report any changes immediately. While we don't expect every patient to remember each detail perfectly, going over this once and encouraging regular self-checks can make a significant difference in early detection and outcomes. Assessing urinary function provides valuable insight into a patient's renal health and overall metabolic state. Let's break down each component we're looking at here. Observe urine color. This is a simple yet powerful indicator. Normal urine is typically light yellow, but darker shades can indicate dehydration, while red or brown tones could point to blood or other issues. Urine color can sometimes give us our first clue into a patient's hydration status or possible urinary tract issues. Testing the pH of urine tells us about the body's acid-base balance. A more acidic or alkaline pH could hint at conditions like infections or metabolic disorders. Specific gravity, on the other hand, indicates how concentrated the urine is. That provides insights into kidney function and hydration levels. The creatinine is a lab value, and it's a staple in kidney assessment. Creatinine is a byproduct of muscle metabolism, and it remains fairly constant, making it an excellent indicator of kidney function. Elevated levels can signal that the kidneys aren't filtering waste effectively. BUN levels can fluctuate based on factors like dehydration or protein intake. It's another indicator of kidney function, but one that is influenced by dietary and hydration status. Higher levels might indicate kidney dysfunction, but it could also be from temporary dehydration or a high-protein diet. Each of these markers helps us build a picture of the patient's renal function and general health status. Together, they give us a broader understanding than any single indicator alone. As men age, we often observe several changes in their reproductive anatomy and function. Let's go over these typical signs of aging. One of the first changes that might be noted is in the pubic hair, which can become thinner and gray, similar to the hair on the head and the body. Additionally, the size of the penis may decrease slightly with age, which is a normal part of the aging process. The testes also undergo changes. They may become smaller and feel less firm to the touch. This change doesn't necessarily indicate any pathology, but reflects the natural aging process. The scrotal sac often becomes more pendulous and lacks the same degree of rugae or wrinkling that we typically see in younger individuals. This is due to a reduction in skin elasticity. With age, some men may notice that sitting for prolonged periods can cause irritation or excoriation of the scrotal skin. This happens because the skin might rest more against surfaces when it becomes more pendulous, leading to chafing or irritation. These are all typical age-related changes, and while they may be new for the patient, it's important to normalize them as part of the natural aging process, unless they're causing discomfort or indicating an underlying issue. Now let's talk about urine color and some of the factors that can lead to abnormal colors. Urine can present in a range of colors, each potentially indicating specific conditions or lifestyle influences. Here's what to keep in mind. Urine color can range from pale yellow to deep amber depending on hydration levels. However, colors like red, brown, blue, or green may signal certain health issues. For instance, red or pink urine could indicate blood in the urine, which might require further investigation. Certain medications, foods, or even vitamin supplements can cause color changes. For example, beets or berries can make urine appear red or pink, while vitamins like B complex might turn urine bright yellow. Knowing what the patient has consumed can help differentiate between dietary causes and potential health issues. Sometimes patients might notice an unusual color in their urine after undergoing diagnostic procedures or surgeries. This is often due to the use of contrast dyes, which are excreted through the urine and can alter its color temporarily. As we assess, it's crucial to ask patients about recent dietary changes, medications, or procedures to gather a complete picture. Remember, abnormal urine color isn't always a sign of disease, but it's a clue worth investigating further if it persists or is accompanied by other symptoms. Let's dive into some abnormal findings related to urinary issues and male genital lesions. Understanding these can guide us in identifying and addressing specific patient complaints and potential underlying conditions. Urethritis refers to inflammation of the urethra, often presenting as urethral discharge and dysuria or painful urination. It's commonly caused by infections and requires prompt diagnosis and treatment. Renal calculi, also known as kidney stones, can cause severe pain, often described as flank pain that radiates toward the groin, as well as hematuria, which is blood in the urine. Urinary retention is an inability to urinate fully, which can lead to UTIs due to stagnant urine. This is often a medical emergency if it's acute, as it can cause significant discomfort and infection. A urethral stricture is a narrowing of the urethra, which often leads to difficulty with urination, a weak stream, or even urinary retention. It might be the result from scarring, infections, or previous injury. Tinea cruris is often referred to as jock itch. This fungal infection causes an itchy red rash in the groin area, and it's quite common. Genital herpes is caused by HSV2. It appears as painful blisters or sores on the genital area. This is a chronic infection with intermittent outbreaks. Genital warts are usually caused by the human papillomavirus, or HPV. They appear as small, flesh-colored bumps and are highly contagious. Syphilis presents in its early stages with a painless sore or ulcer on the genitals. Identifying this early is crucial because untreated syphilis can have serious systemic effects. Male genital cancer, though less common, can present as a painless nodule or ulceration. It's important to distinguish benign lesions from potential malignancies. Each of these conditions presents unique signs and symptoms, and knowing these differences helps us provide accurate and timely care. Be sure to ask patients about symptoms, onset, and any previous treatments, as these details can all guide your assessment and management plan. Now, let's explore some of the structural and functional abnormalities that can occur with the penis. Each of these conditions has unique implications for both urinary and sexual function, and recognizing their presentations is essential for effective assessment. Hypospadias is a congenital condition where the urethral opening is located on the underside of the penis rather than at the tip. This can impact urinary function, and in severe cases, surgical correction might be required. Priapism is a prolonged, painful erection lasting more than 4 hours without sexual stimulation. It's often associated with conditions like sickle cell disease, certain medications, or trauma. It requires immediate medical intervention to prevent permanent tissue damage. Phimosis is a condition where the foreskin is too tight to be retracted over the glands. While it's normal in young boys, persistent phimosis in adults can lead to issues with hygiene, infections, and sometimes painful erections. In paraphimosis, the retracted foreskin can't be returned to its normal position, which can cause swelling and pain. This is a urological emergency because it can restrict blood flow to the glands. Epispadias is a rare congenital abnormality. This is the opposite of hypospadias. In epispadias, the urethral opening is located on the upper side of the penis. This can be associated with other structural abnormalities, and it might require surgical correction. Peyronie's disease is a condition that involves the development of fibrous scar tissue inside the penis, which leads to curved, sometimes painful erections. The exact cause is unknown, but it's thought to be related to injury or genetic factors. Understanding these abnormalities helps us to address both immediate and long-term patient concerns effectively. Remember to ask patients about any discomfort, functional issues, or previous medical interventions, as these details are key in managing and treating these conditions. Moving on to the topic of scrotal abnormalities, the scrotum houses the testes, which are essential for sperm production and hormone secretion. Abnormal findings here can have significant impacts on a patient's reproductive and general health. Let's go over some common conditions. Absent testes, or cryptorchidism. This is when one or both testes fail to descend into the scrotum. This is a condition often identified at birth. It can lead to fertility issues and increases the risk of testicular cancer. Small testes can indicate a developmental issue or are a result of damage from trauma, infection, or hormonal imbalances. Testicular torsion is a true emergency. Torsion occurs when the spermatic cord twists, cutting off blood flow. This is extremely painful, and it can lead to testicular loss if it's not treated urgently. Inflammation of the epididymis is called epididymitis. This is often due to infection, which can result in scrotal pain and swelling. It's important to differentiate this from testicular torsion due to similar symptoms. A varicocele is an enlargement of the veins within the scrotum, often described as feeling like a bag of worms. It may impact fertility, and it can be surgically corrected if needed. A spermatocele is a cystic swelling in the epididymis filled with fluid and dead sperm, typically painless and benign. Testicular tumors can present as painless lumps. Early detection is crucial, as testicular cancer is highly treatable with early intervention. A diffuse tumor is a more widespread mass, often associated with advanced testicular cancer. A hydrocele is a collection of fluid around a testicle, leading to swelling. Hydroceles are usually benign, but they might require drainage if they're symptomatic. A scrotal hernia occurs when part of the intestine pushes into the scrotum through the inguinal canal. It can be identified by a bulge in the scrotal area, especially when straining. Orchitis is inflammation of the testicles. This is often due to mumps or other viral infections. It can cause pain, swelling, and potential long-term impacts on fertility. Scrotal edema is a generalized swelling of the scrotum, often associated with conditions like heart failure, kidney disease, or lymphatic obstruction. Now let's review inguinal and femoral hernias. These are common conditions that cause discomfort and in some cases serious complications. First, we'll cover the general course, clinical signs, and symptoms of hernias. Typically, patients present with a bulge in the groin area, which may increase in size when they stand up or strain, like during lifting or coughing. Some hernias are painless, others can cause significant discomfort. An important symptom to note is if a hernia becomes incarcerated, meaning the tissue becomes trapped, which can lead to an emergency if blood supply is cut off, known as strangulation. Let's look at the types of hernias we encounter. Indirect inguinal hernia is the most common type and often congenital. It occurs when a portion of the intestine or fat pushes through the inguinal canal, typically following the pathway of the descent of the testicle. It can occur at any age. A direct inguinal hernia is more common in older adults. This type protrudes directly through the abdominal wall in the area of the inguinal canal's weakest point. It is usually acquired due to weakening of the abdominal wall over time. A femoral hernia is less common and more frequently found in women. Femoral hernias occur when tissue pushes through the femoral canal located just below the inguinal ligament. They have a higher risk of incarceration and strangulation, so they're particularly concerning. Understanding these types and their distinct characteristics will help you identify hernias and assess urgency. For all hernias, patient education on avoiding strain and monitoring symptoms, particularly signs of strangulation, is crucial. To wrap up, we've covered a comprehensive assessment of the male reproductive system, focusing on both subjective and objective data. We discussed everything from basic anatomy, key assessment questions, and the importance of documentation to abnormal findings like hernias, scrotal, and penile abnormalities, and the unique considerations for different age groups. Remember, thoroughness and sensitivity are crucial in these assessments. We want to approach each patient with professionalism, making sure that they're comfortable with dignity throughout the exam. Always listen carefully to their concerns, especially when discussing sensitive topics, and provide clear, empathetic communication. As you go forward, practice using tools like OLDCARTS to gather detailed subjective data and hone your observation and palpation skills during objective assessments. Understanding these physical and developmental changes is essential in identifying normal variations versus potential health issues. Keep in mind that each patient is unique. Your goal is not just to identify abnormalities, but to offer reassurance, education, and support as needed. Your assessments and interactions have the potential to impact not only a patient's health, but also their comfort and their confidence in the healthcare system.